morning, and thank you all for joining us for another episode of the Compass Ecosystem Podcast. My name is Carolyn Gorst. I am the Director of Development here at Compass Affordable Housing, and I am so excited to be here again today to share with you another exciting Compass Ecosystem Podcast, joined by my fantastic co-host, Lydia Aranda. Hi, Lydia.
Hi, Carolyn. Glad to be here. I know it's going to be another informative and really upbeat episode.
I couldn't agree with you more. And we want to thank this week's sponsor, Tucson Electric Power, for sponsoring today's podcast. Before we get started and we introduce this week's guest, I want to just remind everyone that the purpose of our Compass Ecosystem podcast is to inform, engage, and to connect the Southern Arizona community in a dialogue about our human development ecosystem. And for that conversation today, we have a fantastic representative, Jenifer Patterson with Senior Solutions USA is here joining us today. Hi, Jenifer.
Well, hello, Carolyn, and hello, Lydia. Thank you so much for inviting me today. I'm looking forward to this.
Oh, us too.
We are very excited about today's conversation because July for us at Compass is about Physiological Access Month. And one of the things we are so excited is to have you here to talk to us and educate us on what it is that Senior Solutions USA is doing, the issues you're addressing, the people you work with, and I know this is a lot, some of the services you provide and some of the outcomes that you're seeing in community.
Oh, absolutely. So, Senior Solutions USA, we are local right here in Tucson, Arizona. We are an independent health insurance and Medicare advocacy agency. And I use the word advocacy because we really are here to help our community members and to advocate for them when it comes to healthcare. We are here to help anyone who is in need, but our target audience are those aging into Medicare, current Medicare beneficiaries, dual eligible and low income individuals, also those that are have lost coverage under the age of 65 and looking to be on the marketplace and on and off the marketplace, and those turning 26 who will be losing their parents' insurance. So again, we are here to help folks who are helping their parents, their children, grandparents are now raising their children. So we're here for anyone, but these are our target audience that we look to help. Healthcare is just not about looking at your doctors or your medications, but it encompasses the whole person. And so there's a lot that goes into that. And I began the agency. One of the reasons is, I wanted to be here in the community for the people who live here. And I wanted our agency to be trusted guide for individuals transitioning into either the marketplace health insurance, and most of all, those transitioning into Medicare. Because if you know anything about Medicare, when you read it, it is clear as mud to all of us. Right?
So true. So very true.
And I have 15 agents underneath us and we are growing. But our goal here at the agency is to remove the stress and confusion and data overload that people get, especially with Medicare insurance, to ensure our clients find optimal coverage that meets their specific needs and budget, which can be huge because it's not a one plan meets all and can encompass that. There are so many parts of the maze or the puzzle that we need to put together for folks and to help them find the right health care for for what they need. And I sometimes believe that when people look at healthcare, they're only looking at when they go out. But really, for us, healthcare encompasses 9 social determinations of health, right? It's not just about healthcare because if you're hungry, you can't make decisions, right? If you don't have access to quality care, you don't know what that looks like. And if there is a language barrier, that that can cause and create issues. And housing is huge. If you don't have a safe place to live or to lay your head, that can cause problems. And what about transportation and getting to and from? You may need to go to the doctor. If you don't have that kind of transportation, then who does that fall back on us? They come back to us. And then educating folks. So it's really important that we look at, and when I say educating, is, if somebody is looking for a primary care doctor, it is not my place to give them one. It is my place to help them find one that works for them. And income is important because there are different programs that can help with some of the medical cost or prescription drug cost. And then isolation and safety and environment. So when we say safety, it's not just about making sure that they have a safe place to live, but what about in the home? My grandmother, she has a step, and that step, we've had to go in and put a little ramp, right? So that because she kept falling, or a handrail. And then, you think about isolation, and many of us say, oh, we have our cell phones and we have this and we have that. But that's not the same as having a personable conversation with someone. And my great grandfather said it best. As he got older and he was 85, he said, most of my friends are dead now. And that broke my heart because he's like, I go to work, I have all these people, but I don't have any close friends anymore. So we have to look at all of those in order to help someone find the care that they need. And I think that that's what sets us apart because we do put our heart into it and we do have the community resources. Can we solve all of those problems? No, not at all. But partnering with you, with Compass Health, you have a plethora. How many times have we come over there to you guys asking, hey, can you direct us? And creating those partnerships within our community is what helps lift everyone up.
And I love that you talk about it as being advocacy and education, because I think that's one of the things we appreciate about working with Senior Solutions and we've seen it firsthand. Spoiler alert, Senior Solutions is one of our education partners, and we see it all the time with the questions that people come that they're just not sure where to go next because the systems that they have to maneuver through for Medicare and the healthcare can just become so overwhelming. And it's not just about, well, sign here and check here, but you really are advocating for them. And we love
Absolutely.
that.
And, here are I'm a statistics person. Okay. So I love statistics. Uh, and I'm going to share something. And this is heartbreaking to me. When we look at some numbers here for statistics for people who are 65 and older, Social Security was not meant to be the only income that folks have. But over 40% of our population relies solely on Social Security. And Social Security with inflation today only replaces about between 30 and 35% of the income that that people had before retiring. And do you know that almost 45% of our population live on less than 26,000 a year. Can ask yourself, can you live on that?
Right.
And the saddest statistic of all is 33% of our population has food insecurities,
Mhm.
a third of our population. So when we look at that, and then we're finding that they're getting squeezed out of the housing, right? And we look at that and we wonder, how will someone be well if they can't have their basic needs met?
So well said. We're going to take a quick break here to hear from our sponsor, Tucson Electric Power. And when we come back, I know Lydia you've probably given Lydia quite a bit of information that she has some great questions to follow up.
It's important that Tucson Electric Power partner with agencies like Compass Affordable Housing to ensure the members of our community have access to the resources that they need. We understand that we're operating in an affordability crisis, and this is not something that can be solved alone. Together, we can achieve so much more.
And we would like to thank the sponsor of this segment, which is Zona Training Solutions. My gosh, Jenifer, you really did such a great job of outlining so much that Senior Solutions does. First, I want to just congratulate you on all that work. And you really hit on a couple of aspects, advocacy, as Carolyn mentioned also, and the fact that you are not there to make decisions on behalf of your clients or your partnering organizations. You're there to provide information and resource links and leads so that people can make their own best decisions. So I wonder what that brings to mind is maybe helping our viewers understand a little more how your agency then tackles some of those specific areas you brought up. I mean, I heard food insecurity, safety in a home, maybe trying to find a home, or just interacting and being connected in community. So do you take that a step deeper?
Oh, yeah, absolutely. So when we look at some of the food insecurities, some of the things that we have done is directed folks. One, we have a list of where they can get food besides our community food bank, right? Because everyone is aware of the community food bank. They may not be aware of how to access it, which is where some of our partners come in. But the other is, we have a list of churches and places where they can get food. We also have plans based on their financial and medical that they may qualify to provide some food benefit to them. Now that there are a lot of, we ourselves can't decide. It's the plan and based on income, rather they decide, but that is an option for them. And the other is we do have some of our plans that do provide resources to help with, hey, I need to get grab bars in the shower. Some of our plans provide some of those resources to members based on need, right? And then when we're looking at, let's see, that's not an option through the plan they choose, we do have programs in here that information and literature that we can give them that partner with some of our other community members to find a way that they may be able to get some of that durable medical equipment or have grab bars put up. So, many of the carriers or the plans also have websites and case managers to help with that. And then when we look at education and communication to keep them from isolation, we work with several community partners, and a lot of our value-based doctor offices provide education and classes in their facilities, so we can direct them in that way as well.
That's really great. And I think what I also hear in the relationship that you have with agencies is trust. So you help the seniors and their family members perhaps build trust in them, and you clarify as an advocate to walk them through and making it a little more clear to them, a little more understanding, and they can trust your judgment. But also your partners trust you. So when they're referring people over to you, those seniors can walk in and know that they're finding a good advocate in your agency. That's what I hear is maybe one of the most important entry points.
I agree. It is. And we like to do a soft handover if it's possible. It's not always possible because not everyone provides, allows that type of handoff. But if we can, where we can do a soft introduction and introduce the client or the customer with that particular entity to help them along the way. And that's half the battle sometimes. It's not just one is asking because people don't like to ask, but two is once they get it, sometimes they're afraid.
It can be very confusing. Carolyn, I'm sure all of your team at Compass Affordable Housing has had lots of interaction between your tenants, your other partnering organizations, perhaps, and Senior Solutions.
Absolutely. And Lydia, you bring up a very good point. And that is that with Compass, we've had the opportunity to partner with Jenifer and her team. And I'd love for you to share, Jenifer, with our viewers today some of the ways that you and your team have participated in helping create a more connected human development ecosystem with the services you provide. Specifically, share some of the work that you're doing in community. It's very exciting.
Oh, I know. We love it too. So some of the things that we do, obviously, the number one thing that most of us do is, a Medicare 101. All of us do that. But the other things that we do is we go into communities, we do food demos, we do paint and sips, now not non-alcoholic. But the uniqueness in our paint and sip that we do is that we are working with PAC. I have a team member who's working with PAC to help save those animals that may be euthanized, while also providing this community for people to come in and paint, right? And meet each other and get some food. We have some snacks and sip on mocktails is what I like to call it, right?
Sure.
We also provide, we go out and we do events like, senior fairs, other health fairs, employer fairs, these different communities that we have partnerships with. They'll have us come in and do events. So one of the things that I really want to do, I just got a karaoke machine.
Oh my goodness. Okay, I feel like there's an event coming up.
Well, I want to plan a karaoke event because everybody has bingo and that, but who has a karaoke event?
I think we're onto something here. I think we need to be working on this one.
Yes, so I haven't even tried it out yet because I personally, everybody can sing. Carry a tune is a different story, and that's not me. I can't carry a tune. But I think that if we can bring these fun activities into our centers, either, community centers, our housing places that folks can have fun. Because when we can have fun and not think about all of the everyday life that could be overwhelming, our stress level goes down. And when our stress level goes down, our health gets better.
That's right. Music is a great connector for so many, and memories, especially when we're talking about seniors.
Absolutely.
A favorite tune, it might be a nostalgic or a sad tune, but it then sparks communication in one way or another in a connection.
And it's beautiful to be able to connect people in that. The other thing, that I think is important in our agency, we're all licensed agents, right? We're independent. So that means that we work for the client, not for any particular insurance company. But we also have folks in our agency that does property and casualty insurance, that does legal insurance, legal, prepaid legal, which can help, believe it or not, with power of attorneys, right? PO, and trust and wills, those kinds of things that we have. And my goal is to build this agency so that we can offer several different areas for folks to be able to come in and get things done. Because when you imagine coming into the office and you need to talk to somebody about your Medicare. Now, we can't talk about Medicare and property and casualty at the same time. But if you feel like you have a trusted agent in the Medicare scene, right, then you're likely to feel a little better to sit down with a partner that they work with for property and casualty, because it is about family. It's about treating our clients as family. And as family, you get to meet other family members. And to me, that's important. I mean, and how many times have we come over there and saying, hey, can you help us? And you have. And if you haven't been able to directly help us, at least direct us in a way, hey, this, over here might be a better place for you to be. And when we look at being able to connect with trusted family members, as that's how I see it, right? Then as a community, then we are able to increase people's quality of life, which is that ecosystem, right? It's not just about health. It's about life. Yeah. It's about wealth. And when I say wealth, I'm not talking just financial, because that's financial. But wealth can be what you feel makes you feel wealthy, rather it be taking time with your grandchildren, traveling, whatever that might be, and then care. So different than health is where you get care, right? And care can be just love. Mm-hmm. So when we can create those types of communities and families, as they always say, the parts, right? The whole is bigger than the parts. And so if we can take all of the parts and put them together to equal more than 100%, then we've served our community.
That is so well said. And I think that ties in so beautifully to creating a community, creating an ecosystem that serves the community. We're going to take a quick break here before we close out today and hear from our friends over at Tucson Osteopathic Medical Foundation.
Annually, we give to local organizations who are running programs and making great strides in what we call the social determinants of health. It's incredible the work that they're doing, and we're just really proud to be a part of it.
Welcome back. This next segment is sponsored by Zona Training Solutions. Jenifer, I want to thank you for a lot of those in-depth descriptions that you gave and kind of putting those pieces together, because there is so much that Senior Solutions offers. And one of the most important things would then be to let our viewers and our listeners know how to get in touch. How might they find you if they're in need of your services? Also, I'm going to say, perhaps there are resources you need. So if someone is looking to volunteer or maybe even donate or support some way your organization, how might they get in touch with you for that as well?
Oh, perfect. Thank you. So you can contact us via phone, and that is 520-275-3529. You can send us an email, and that would be Jenifer, Jenifer, @ seniorsolutionsUSAZ.com. Can also find us at our website at seniorsolutionsUSAZ.com. We are also on Facebook, LinkedIn, and I think that's it,
Sounds
right?
like some great opportunities to connect in various ways. So you're meeting your folks where they are, and they have a lot of options of reaching out to you.
Yes. Thank you.
That's great. And Carolyn, I don't know about you, but I'm thinking if there's anybody out there in community that either might be thinking of auditioning to come participate in your karaoke, maybe as a lead volunteer, maybe there's someone with equipment that might help you.
Yeah, that would be so fun. And so I I know nothing about karaoke or putting it on. I just know about events. So if you guys want to help and get together and think of a place that would love this, please reach out because I think this is something that I've not really seen, and I think it would be a lot of fun.
I
Well, I
think
think
you're
Carolyn's
right.
probably got her head spinning already. I'll toss it to you, Carolyn. What a
I
what a
I
fun
absolutely
idea.
I absolutely agree, and I think that Compass will continue to be talking to Senior Solutions. We love having you come on to our properties and working with our residents. People have commented how friendly, approachable, and trustworthy you and your team are. So thank you for that because these are hard conversations and aging is not easy. And as we age and take on how do we navigate, it is great to have someone in your corner as trustworthy and as reliable as our Senior Solutions USA Arizona team. For all of our A special thank you to Jenifer for being here today and sharing so much wonderful information on the work you and your team are doing here for our older adults and our aging population. And for anyone who would like to learn more, we welcome you to stop by our website at www.compassaffordablehousing.org. And we'll look forward to seeing you all at a karaoke sing coming soon to a property near you. That's
Sounds
all this
good.
week. We look forward to seeing you next week. Thank you to Lydia. Thank you to Jenifer. We'll see you all.